Welcome, everyone, to this special event on navigating stress in our work culture with Transcendental Meditation. Our special guest today is Dr. Gagné, a renowned expert on the science of Transcendental Meditation, or short TM. So today, our work culture is steep in stress, and whether that's due to intense deadlines, performance pressure, rapid change, or an ever-evolving labor market, the common result is burnout across the board. So you may be here today and asking yourself, how can we protect ourselves or become more resilient when dealing with the perils of stress and burnout? So tonight, Dr. Gagné, who is also a medical doctor, will discuss the latest finding on the effects of transcendental meditation on physiological distress and brain function in professional settings. And you will have a chance to learn more about the mechanics that make TM or transcendental meditation a powerful tool for fostering resilience, reducing stress, and enhancing emotional intelligence, or EQ. And Dr. Gagné will also explore the link between some of these benefits and an increased organizational effectiveness, improved work productivity, and effective leadership. And tonight we'll start the session with a presentation by Dr. Gagné and then stop the recording so that you can ask your personal questions. And we'd love to have you come unmute, or you can put your questions in the chat and we'll be happy to address them for you. So welcome, Guy-Paul and Dr. Guy-Paul. And before we dive in, let me just take a minute to introduce you to everyone for those who haven't met you yet. So Dr. Gagné is a medical doctor and former assistant professor in the Faculty of Medicine at McGill University in Montreal. And he's been also a prolific speaker on maternity care and the scientific research on TM, including its application in education and stress management. And on top of all of that, he has 30 years of experience in clinical practice, teaching, and research. So a warm welcome to you, Dr. Guy-Paul Gagné, and wonderful to be with you tonight.
Thank you very much. Thank you for inviting me. It's a pleasure to always to share my experience, my own experience, and my also my knowledge about the scientific research on TM. You see, I have a long story with TM because I started. I won't tell you my age, but you know, I was learning medicine at the late 1970 when I was in training, and I think I was sleep deprived and very stressed and worked out and almost burned out and all of these things. And I think TM saved the game, you know, at some point, you know, as a physician, as a resident physician, I had to take care of patient, and my practice in obstetrics needed me to be up all night sometime, and all of these irregular schedule and everything. So everything not very healthy. So I needed to protect myself against this, and I found this trick. So I'm happy to share, you know, what happened, and especially with my knowledge, scientific knowledge, over the years, I kept, you know, checking what was happening, because TM is famous for being studied a lot. You know, many studies were done to in so many fields of life, working and, you know, education and all sorts of and brain imaging, and a lot of medical discoveries were associated with TM. But so I kept, you know, informing myself during my life and as a professional. And what was great is that every time I had some experience or some, you know, I could notice some difference in my life due to my practice, or maybe I wasn't sure if it was due to my practice. I found some study, you know, proving that it was actually this making the difference. So it's a little bit of that I'm going to share today with everyone. So let's start. I will share my screen with here. Yes. That should be it. Yeah, TM for professional stress and burnout. First, we could spend a lot of time talking about how bad is the situation, the workplace situation now. And it's, you see, me in my profession, we were very busy and working very hard, even in the 70s, but now it's even more, and it has spread everywhere. I think one of the reasons why we became so overwhelmed in work and everything, I think it's because, actually, strangely enough, it's probably because of evolution of technology. Every time something is coming up technologically to pretending to help us, making our life easier, we jump on it, and we actually don't save any time. We just become more productive with it. So it's kind of a vicious circle. We have more ability to communicate instead of just, before that, we had to write a letter by hand and then send it to the mail and, wait a couple of days for the answer. Now it's automatic like this. So we all said, oh, that's great. We won't have to work so much, but actually it didn't happen because we kept piling up these things. And I think technology has taken a large toll of our quality of life and rest and everything. So we need something to compensate. And I think TM is a very good candidate for, taking care of all of this. So psychological stress, as I said, we could spend a long time, but actually World Health Organization in 2013 came up and say, psychological stress is one of the most common occupational health problem affecting workers worldwide. And its technology has it has saved a lot of life, and it has improved our quality of life a lot. But on the other hand, it hasn't asked us for more and more productivity. And at some point, we have to find an equilibrium between quality of life and productivity at work and even at home. Psychological stress negatively affects organizational commitment, work engagement, productivity, as well as contributing to poor mental and physical health. So it's a big deal. It does affect people worldwide, and it can be damaging. Actually, World Health Organization is worried that a lot of our advance in medicine, in preventing disease and having better diet and lifestyle and exercise and everything that we've learned, we are starting to lose a little bit on this, and the equilibrium of health people are afraid it might come down eventually because of all this situation. Anyway, so that's a big thing. And so we will discuss the possibility of TM being a very important, not only preventative, but sometimes even cure to this problem. But before we go into the detail of TM, I'd like to stress the fact that, you see, 40 years ago when I started TM, it wasn't difficult for me to make a choice about what am I going to do. I was sleep deprived and stressed out, and I thought I was reading scientific journals. So I go to this scientific journal and I see an article about TM, being a new approach, meditation, because back in the 70s, meditation was kind of new in the West. Now it's not the case, but I remember back then, you know, for me, it was like, what is this? And then I read the paper, and they were saying scientifically, you know, cortisol level, the stress hormone was lower, and they had made some research, and it's very promising. And oh, well, and being in need of relaxing. And also they said, you know, in this article that TM will produce deep physical rest. And the rest during the 20 minutes of TM is worth maybe 4 or 5 hours of sleep. So I said, oh, this is what I need. You know, kind of this concentrated form of sleep. So I decided to go and learn. But then immediately that was very interesting experiences. But maybe I won't describe all of these things, but I want to say that back then I didn't have any problem making choice. I didn't have any choice. Today, there are lots of possible choice. Everybody will tell you, well, we can do this and this and that, and this sort of meditation and this other one, and maybe try this one and this one. So it becomes a bit difficult. So we have to, I think, I spend a lot of time in the last 30, 40 years studying this aspect. And I can tell you right at the beginning that all meditations are not the same. So that's one point that we should stress at the beginning. So that's why I want to show you this slide here is there are the scientific community finally came with it was about in 2010, you know, it's fairly recent, about only 13 years ago, that finally the scientific community came to an agreement about classifying the type of meditation according to their level of cognitive control. Okay. What do we mean by cognitive control? Is the amount of effort that you have to do with your mind, with your brain, with your thinking process, the amount of work you have to do when you practice the actual technique. So there are 3 levels. They have divided the different meditation techniques in three different categories. First category, focused attention. Focused attention are the most commonly known is, I think, they call them, it's like Zen meditation, when you focus on one thing, like sometimes you see this picture of focusing on a candle, on a light or something, or even on a thought that you have to maintain. So focused, it's a sustained focus and voluntary control of attention. And you control the cognitive process. If your mind wants to go out of your concentration thing, you have to bring it back. So this is actual very strong control of the mind. So there you can understand them into concentration techniques, concentration. Then you have the open monitoring type of meditation. Mindfulness is very much into this category. Open monitoring is only observation. You don't absolutely control the mind, but you put yourself into witness of what is going. It's dispassionate, it's non-evaluating. It's and you put your awareness only on ongoing experience without judging, but you're still observing. You have a job to do. It's kind of a job. It's less than focused attention. And then you have the third category. Third category is TM. This TM is, as far as scientifically known, is the only one. You have many other meditation in focused attention and open monitoring, and you know, there's so many different techniques there, but they all involve some cognitive control. TM is automatic self-transcending. It's effortlessly transcending. You don't have to control anything. And this is the big difference with TM compared to other kind of meditation. That's why I'm not saying the other meditations are no good. They have their own advantage, their own effect. And they also are very often good for managing stress. But TM does this. I think it's a bit superior for managing stress, but it does a lot of other things because it's effortless. Being effortless, it gives this it means actually it's kind of amazing. We will discuss this later, all the benefits of practicing TM and then you have all these benefits with no effort, effortlessly. So that's very much different than many other techniques. So anyway, what is so different about TM is, and then in practice, I just want to show you this difference, but in practice. You see, today we won't learn about how to practice TM. I am not a TM teacher. And also you need to have a specific training by a teacher to do it. So it won't be today, but I can tell you a little bit the difference with this. The TM teacher very often will compare the mind, the thinking process, like an ocean, like a lake. There are some waves at the big, the waves at the surface, they are active, always waves are there. But if you go at the bottom, it's very silent. There's no activity much, And if you have a bubble of air that comes from the bottom of the lake, it's small at the beginning and then it becomes bigger and then it bursts as a bubble, like a conscious thought would do. Thoughts are like that. They come from the bottom and then we are eventually conscious of them. It's like the consciousness has some layers. Like you have conscious, subconscious, subliminal. Anyway, the psychologists always, are talking about these layers in vertical. Other meditation always are watching the waves. They are either focusing on a wave or watching the wave going in and out and in and out and here and to the right, to the left. This is open monitoring or focused attention, but they are always there on the top. TM is different because TM, it uses a sound that it has no meaning, and then you have to be taught how to use it, but you use it in such a way that eventually the mind dives deep into itself, and then it reaches at the bottom, the source of thought, where there's very silent, very silent. Transcendental meditation is effortless transcending, okay? Effortlessly transcending. You do it it's an automatic process. I remember the very first time I went for TM at the center in Montreal, the teacher, gave me the explanation. It takes a couple of days, you have to have some meetings. And if we want more information about how to do it, maybe at the end, some teachers will explain to you. But anyway, I remember then I knew what to do, and then they said, okay, go, start it. And when I close my eyes and I start, it's like cutting the cable of an elevator, boom. I felt this silence and I was in need, if you remember, I was in need of a lot of rest. And I had this experience of something I never, some kind of a space inside my thinking process that I never had explored before. That was very nice. And from there, I could never stop, having this experience because it's so rejuvenating and everything and so effortless. Anyway, so that was my experience. But then I kept looking at the medical research about this, and it's not so, it took many years before we had the scan, the possibility of scanning the brain during meditation. It's maybe only 15 years ago, maybe 20 maximum. Anyway, so that's TM. It's a brain imaging of someone practicing TM. And you see, in brain scan, the red means that there is more blood flow. And when it's blue, there is less blood flow. Okay, so the brain roughly is divided into the higher brain. The higher part of the brain is the thinking brain. And the lower part of the brain, it's like the automatic pilot of your body. The thinking brain, when you think, you make your decision, everything, it's from the, the top of the brain. And the bottom of the brain is like it's driving your blood pressure, your respiratory rate, your glucose, your cholesterol, all of these things that are automatic and we never have to think about them. They're just driven by themselves. The body just does its job. It is what puts you to sleep and then wakes you up in the morning and all of these things. This is the bottom of the brain that does these automatic processes, okay? And you see here, it's very unique to TM that during the practice of TM, there is more blood flow to the upper brain. The thinking brain seems to be more active, while the lower brain is at rest, okay? And that's a bit paradoxical because normally, if the upper brain is very active, the lower brain will follow because you have to keep you awake and doing your job and everything like this. And then if your top of the brain starts to rest, then the lower brain will follow and go to sleep. Okay, so they usually work together. Now they seem to be doing the opposite, and it's very unique. No other meditation will give that kind of pattern. We call this, the researchers, when they discovered, well, they had described it in the 80s, in the 1980s, but they call the restful alertness, meaning that the body is in a profound rest, which is worth some time of sleep, free sleeps, but the upper brain is working, it's alive, it's not sleeping. So that's why it's called restful. The restful is the blue, and the red is the alertness. So we're going in practical now. What does it do? Now, I hope you guys understand what it does, but to the brain. But what does it do in life? If you do this, what's going to happen in your life? I have a quick example of a research. I like this research because it kind of summarizes restful alertness, what it is. You see, in the US, there is this epidemic of high blood pressure, even in teenage, in school age, college student and everything. And they're because of accumulated stress, you end up having high blood pressure and everything. And physicians were looking for a way of reducing the blood pressure on the youngsters, without giving them pills, because taking pills for the rest of your life, it's kind of so they collected this group of students. They were teenage, and they spread the group in two. It's about 50 or something on both sides. And one group was taught TM, and the other group was just doing business as usual. But they wanted to control what the difference would be between the two groups. They kept going with their school and everything. And the students were practicing TM in school in the morning, and then before they go home in the afternoon. Okay, after 4 months, blood pressure was lower. Actually, came back to normal. In the TM practitioners, and the control group, not much difference. But so that was good. And then another special thing about this study is that after 4 months, the study was over. They were very happy to have shown that TM is effective in reducing blood pressure. But just for control, just to see what happened after a certain amount of time, they came back another 4 months later, and blood pressure was still low. Despite the fact that the program was over in school, and maybe these kids, they were practicing TM a little bit at home, no matter what, it seems like they had reset the lower part of their brain in a restful manner, that the blood pressure came down and it stayed down. So that was kind of a good news, even for them. But at the same time, the researchers, they follow the same population, the same bunch of students, and then what they found is that another study of the same population show a beneficial impact of TM on absenteeism, rule infraction, and suspension rates. That was a bit of a surprise, because that was not the reason of the study, but actually what happened is that this is the alertness part. You see, when they were practicing TM, they rested their body, the lower part of their brain rested, and the body became very much restful and got rid of the stress, and blood pressure came down. But the brain lit up, the more blood flow to the brain. So they had better thinking, clearer thinking. They actually became better students, because they found, that skipping school is not so good. Rule infraction, why do it? They stayed in the rule, and they had less suspension rates compared to the group, the control group. Again, they were compared them. So actually, you see, this is restful alertness, rest of the body, but alertness of the mind. You become, thinking is more long-term. They became better students. So I will just expound a little bit on this. If you practice TM, and let's say you're a physician, or you're a plumber, or no matter what you are, you're in better health, and you become better at doing what you're doing. So that was found in later study in many fields of life. You tend to become better at what you're doing, because thinking is more clear, you're more innovative, more creative. That's what happened to these kids. That's only an example. We'll see. I'll show you why in the next in the presentation very soon. How does stress affect us? I'll just have these two concepts I would like to explain. Is brain plasticity. Brain plasticity, it refers to the capacity of the brain to modify its structure. We used to think that the brain was a kind of a static organ, that brain cells we get them, very early when we're born, and then we grow up age 20, and then it kind of freezes there. It's not true anymore. The brain is very plastic, and actually it will change depending on your experience. And then this is brain plasticity. And then allostatic theory. Allostatic theory is, when exposed to stress, the brain will change its structure to favor survival. Because if you're under a lot of stress, you have to face the situation. You have always to face the situation and go for it. Then the brain will favor these short-term reaction, not planning long-term is not going to be so important. And it's like you extinguished always the fire. You become a firefighter. You see, if you have this feeling that you never have time to do anything, that life is going by and you're afraid that you're missing out on your life because it's just going too fast, it's because you're probably in survival mode in a way, or different level of it, but it's a bad feeling. And unfortunately, it's extremely common that we have this feeling of having no time to do nothing. When you practice TM and then you grow into this capacity of restful alertness, you have more time to do more things. And it's not like you're always running. you just find a solution to do what you have to do without burning yourself out. So when exposed to stress, the brain will favor survival. When it does that at the cost of development. Development is just what I told you. If the brain is more in development, then life, you see, if you're always stressed out, life is a struggle. It becomes a struggle. And if you're more resilient and your brain is more relaxed, then things will go fast around you. But all of these challenges will be considered as possible ways of improving, possible ways of learning things. You see positively things more. It's not so, well, it's not so much that at the beginning your life will change completely, but you will learn how to make it better and eventually probably change things. Anyways, that's development mode. The cumulative effect of stress build up, it's called produce allostatic load. That's the physiologic explanation for accumulated stress is allostatic load, and I'll show you what it means. You see, we think that usually we used to say that you're born with, you inherit from your parents, and you have your body, your genes, and everything, and it's pretty much, you know, the way you are. But we know now it's not true. Some experience can deeply change your brain plasticity by epigenetic. Epigenetic is the capacity of the DNA to manifest itself more or less depending on your experience. It's like putting a dimmer switch on your DNA, and then if you have lots of stress all the time, then the DNA will favor all these rapid reaction, fight or flight, and either it's going to be aggressivity or anxiety or insomnia, these like this, they will be increased, and then you will lose on health and well-being. So these are the epigenetics. So epigenetic will change your brain, and that's going to affect physical and mental health. We saw it before. But what's new with TM is now you understood that restful alertness is a very specific experience that you cannot have. I don't know of any other situation that produce restful alertness. I haven't seen it in any research or anything. TM is very unique for producing that state. And then restful alertness will have a very positive effect on mental, physical health, and then on behavior. So this is the way it goes. And schematically, what happened is that it's all about cortisol. Cortisol is the stress hormone. When I am under tension, my cortisol level has to go up. Here you see cortisol level is the gray line. Cortisol level goes up. Then after the stress is over, normally resilience should bring down my cortisol level to its basal level. But the problem is that with the actual life, the speed of life that we're living and everything, no rest, blah, 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 too much work. And the thing is, the body very often does not have time to bring the cortisol level down to its basic level. And then I have another stress, then I have another stress, then I have another stress. Then eventually you build up a new baseline cortisol level, which is higher than the normal. And then the thing is, when you end up with this permanently. And then when you have a stress, there is no more capacity of bringing your cortisol higher up because it's already too high. It's kind of, there is no left possibility of going up. So then what happened is that you lose the capacity to adapt yourself to new stress, new challenges. They become overwhelming, and then it's too much, and then I can't deal with that. And this is where you burn out, okay? Because there is no more capacity of reacting. And the difference of this level of cortisol, which is higher, it is chronic stress, and the normal one is allostatic load. The physiologists, they can measure this. We can actually make a test on anybody, and they can kind of decide what is the allostatic load on a specific individual. Okay, allostatic load. You see here, this is the chronic stress survival mode. You know, always it's an illustration of the allostatic mode. Here we measure, and it's measured basically. There are many ways of measuring it, but the most commonly accepted is systolic, diastolic blood pressure. We'll show you if it's high or low, and cholesterol, glycosylate, hemoglobin is diabetes. It's an indicator of diabetes. Cortisol, norepinephrine, epinephrine, these are stress hormones. Of course, you know, if they're high or low, or you have at the baseline or not. And then dihydroepiandrosterone sulfate it's an hormone secreted by the adrenal gland that are inversely proportional to age. So actually, when you're born or when you're young, you have a high level of this hormone. And then when you grow older, usually it goes down, okay, with age. So all of these things, these hormones and different indicators are actually decreased, better, improved by TM. Many research. We could spend time on that, but many research have shown that TM is good for blood pressure, and that we'll see a few of these studies after, just after that. But and then cortisol level is lower, and then the dihydroepiandrosterone sulfate is usually higher. It means that, let's say I give you there is a small study showing that, let's say, for example, you take 50 years old people and you measure their dihydroepiandrosterone sulfate. They are usually, for practicing TM, they are usually like 40 years old instead of 50. See, 10 years lower. So that's very good for longevity. Anyway, so that's one of the things. When you're in development mode like this is practicing TM with TM usually, and that there are two studies that have shown this. They tested in lab tests, you know, the reaction to stress and everything. So they found that the people practicing TM, they have a lower cortisol level. And then when they are under stress, because they did this test, you know, in the lab, stress them with pain and things like this. There are some tests they can do in labs. So they usually show a much higher response. So it means that you can react to stress more effectively. This is actually good stress because cortisol goes up and save you from the situation or help you deal with the situation. And then the big news is that TM help the cortisol to go down to its normal level. So this is called resilience to stress. Anyway, this is it. And then that's going to make a big difference on even at work. So now we come to work. Stressful work. This is a very nice study that was done in 1988. 13,000 Swedish workers were followed for about 20 years. I forgot exactly the number of years, but very long time. They followed these workers with questionnaires and their health status and everything, and they could follow their disease and everything. And they found that if the workers are subject to high demand in the context of low work control, they call this job strain. That's high demand, not much control, then you become sick. Kind of. This is the ground for burnout. Okay, they found that increase in these people with this kind of work, they had increased the prevalence of cardiovascular disease by more than twice, two times more than a person without these stress. Actually, work stress is very bad for cardiovascular disease. And I'll just give you a few examples. They said, many people say cardiac disease are due to cholesterol, are due to, bad diet and everything. Like they're risk factors. Risk factors for heart disease are this, are this, are this. But someone made some intelligent studies about work relation with cardiac disease, and they found that job satisfaction is probably the most important risk factor for cardiac disease, over and above diet and lifestyle and everything. So that's funny to hear. Not funny, but it's just, we wouldn't expect that so much. And another guy made some research about during a week, when is the peak time where people have heart attack. And guess what? Monday morning. Monday morning is the worst time of the week for people to have an heart attack. It's the most common time of the week, because starting the week, oh no, I don't want to go there. Stuff like this. See, it's very bad. We have to be comfortable in our work, because it's no good for health. And actually, TM was shown over the last 20 years. Lots of study came out about TM and its protective effect on cardiovascular disease. Cardiovascular mortality, myocardial infarction, stroke are reduced by 48%. This is a study about 202 subjects. The mean age was 72 years old at the end, because they followed these people for about 8 to 10 years. So they were about 62 at the beginning and then 72 at the end. But overall, and they had two groups. They had a group practicing and a group not practicing. The group practicing was better off, 48% reduction. All-cause mortality, even for cancer. Life expectancy was 23% improved. So that's big difference. And that was done they were published in 2012. And then it led the American Heart Association to conclude, that after researching all kinds of meditation and other ways of preventing heart disease, they said TM is the only medication practice that has been shown to lower blood pressure. So that was in 2013, following all this string of studies. So, well, it just says that right at the beginning, practicing TM gives a big protection for this accumulation of stress at work and preventing cardiovascular disease. Now, we discussed about accumulating stress, allostatic load, but now there is the psychological effect, burnout, psychological effect of these this accumulated stress. According to World Health Organization, the burnout is a syndrome resulting from chronic workplace stress that has not been managed. TM can manage it, but if you don't, feeling of energy depletion or exhaustion, increased mental distance from one's job, and feeling negativism and cynicism at one job, and reduce professional efficacy. It's very well known that it has a big toll on professional efficacy and efficiency at work. So burnout is becoming a problem, not only for the workers, but for also the employers and the companies and everything. So it's something that should be dealt with systematically. So being a physician, I was interested always a little more about what's going on in healthcare, because burnout is extremely common. And after the pandemic, now it's out of control almost. Healthcare system all over the world are under a lot of pressure, no difficulties maintaining the workers and everything. But anyway, so just to make a long story short, TM was tested for a group of nurses, 27 here, and burnout was reduced 18%, and PTSD, meaning that stress, in the healthcare system, then now we very often are faced with, difficult, bad, life or death situation and emergency stuff like this. So that's his tendency for PTSD is more. So resilience was more than 17%, and then they saw a very great potential of the technique to for retention and recruiting personnel, because it's a quality of life thing that you give. So many organizations, many healthcare organizations in the US are contemplating now adding this for their workers because it's good for retention. But the best one I saw for physicians and nurses was during the pandemic. There was a big danger of hospitals were not able to deal with, the amount of work. Emergency rooms were flooded and with patients, and then they did this study, 65 healthcare provider with 60, and they compared to 65 same kind of workers, but doing their lifestyle as usual. Okay, so lifestyle as usual, health worker practicing TM, and that was a big surprise, that study, because after only 2 weeks, there was 45% reduction in anxiety, depression, somatization, 33% insomnia, 11% improvement in well-being. This group of research, that was in Florida, 3 hospitals were involved, and the researcher, Dr. Mark Nestor, was a bit skeptical, about how can a mental technique, really be so helpful. So he wanted to know very quickly. Normally, in all previous study about TM, they would not check the people after 2 weeks. They would say, wait, for TM to work a little bit more. They usually do it at a month or 2 months anyway. So he insisted on having tests done after 2 weeks, and then big surprise, big results. So he said, in an interview, the results are dramatic, not just because the size and significance of the improvement, but notably in the fact the rapidity of the result we're seeing. He says this rapid and dramatic improvement in stress-related symptoms is not usually seen with the use of medication, much less with other easy-to-learn mental technique, because I think he had tried TM himself and found it was so easy. How can this easy thing like this can give such a profound result? So now we're going to be looking at eventually why it is so quick, but just to keep going on the effect of mental stress in the workplace. I mean, the worst of the worst is PTSD. Okay, so this study was published in the Lancet in 2018. Lancet is very well-recognized medical journal, peer review. Everything they publish is completely very well verified and good quality research. More than 200 soldiers found TM almost twice as successful as treating PTSD as other therapies. I'll tell you a bit of this story. PTSD is a big problem with veterans in the US, and they kind of don't know what to do too much. Solutions are not obvious, huh? And so they have a technique. The psychologists teach them a technique. It's called PE, prolonged exposure. It's kind of the gold standard for treatment of resistance PTSD symptoms. People who had other techniques and everything, they call it PE, prolonged exposure. It means it involves to recall the trauma, prolonged exposure, meaning you expose yourself again and again the trauma itself in order to kind of learn to live with it or appease this kind of anyway. So it's a tough therapy. Many people quit, and it's expensive. You need very specialized psychologists with PhD, very well trained in that approach. So they decided to compare this approach with TM. Strange, because TM is much simpler. And they said, they have they call it a non-inferiority trial, meaning that they were not expected TM to be better. But they said if TM is only the same, not inferior to it, that would be great because it's so easy. It's available all over the place. You don't need to be a specialized PhD psychologist to teach it. You just have to go to your city TM teacher, and he's not specialized on PTSD. He's just going to teach you a simple technique. And if it's at least the same, that would be great. So you call this a non-inferiority trial. Anyway, you understand. So they did the trial. Look what happened. Actually, Transcendental Meditation is superior to prolonged exposure. Not even non-inferior. It ended up to be superior. The CAP score is clinician administered PTSD scale. Anyway, they score much better after. Mean change of CAP score, minus 16, minus 11. Health education is, they do just education, usual care. This one is the PE. PE had some effect, but just like this, simple mental technique, you get much better results. Same thing for many other kind of symptoms. TM ended up being superior. So I won't go into detail of that, but if TM, and I forgot to tell you at the beginning, these soldiers, I was reading the article, they were very sick. They took the sickest they had because they didn't know what to do anymore. Drug addicts, alcohol consumption, many suicidal attempts, very difficult cases of PTSD. Very unfortunate. You feel very unfortunate for these people that went to war and then come back and cannot have a decent life. Anyway, so they were very sick. So very surprising. So if TM is able to do this for severe PTSD symptoms like this, imagine what it does for a usual worker. Okay, so this was my experience also with my own practice because as a surgeon, I have to face a lot of difficult situations sometimes, and I'm very happy at all my career I was able to deal with that without getting too much of these bad dreams and all of these things. So now I want to introduce, having seen this treatment of stress with TM, there is a new concept that I like it very much. And I think that's also very unique. It's emotional intelligence. Now we're going back to ordinary workers, okay? Ordinary workers. 96 supervisor and administrative staff of a school district in California, okay? They were matched 48 control, 48 TM. And then they taught them TM, and after 4 months, compliance was 93%. So that's important also, because PE, this treatment I told you for PTSD, 43% of the veteran quit because it's too difficult for them to do this. And I forgot to tell you, 2 of them committed suicide during the time of the research in the PE group. So meaning it's a difficult treatment. It's reminding always so it's kind of dangerous almost. So compared to TM, it's just goes like a breeze. So you see this same thing here. So compliance is good. Compliance is very important because it means it's enjoyable, it's easy. You keep doing it because you find the effect. That's my experience also. Anyway, but the big surprise is that this psychologist was measuring emotional intelligence, which is a new concept. And emotional intelligence is usually, you cannot learn that in a book. It's like some people have it more naturally, but unfortunately, maybe people don't have enough of that. And that's why there's conflict and at work it's difficult and all sorts of things. So emotional intelligence was very significantly increased compared to the control group, which actually during the study period, emotional intelligence almost went down a little bit, but emotional intelligence for TM went up. What is emotional intelligence? I'm going to define it. It's defined this way scientifically: the ability to perceive emotion in oneself and others for successful action and problem solving. It favors psychological well-being, stress management, and mental health. But it is also, by research, we know that it is linked to organizational effectiveness, work productivity, and effective leadership. Why? It's because people who can perceive emotion in oneself and in another, they're always in better control of the situation. And I say we don't work alone in a silo. You know, we have to interact with others at work, and we have to have new ideas, solve problems, and everything like this. And the psychologist says that the decision we make, we almost never make our decision only on rational. We have to use the emotional side of the brain. Everybody does it, but the extent at which you're able to dig into the emotional side of your brain will make a big difference in the quality of organizational effectiveness, work productivity, and effective leadership. That makes a difference between a real leader that will be liked and appreciated and another one that will be, you see these people, okay, I'll come to some example later. Why is EQ so important? Is that proper decision and action must engage both the emotional and thought processing area of the brain at the same time. If you make your decision only on rational, super rational people, sometimes they have bad judgment. They don't go well with others, and they don't make decisions that seem to fit with the situation. Because rational only, we're not only rational animals, we're also subjective, we're emotionals. So it has to be taken into consideration. It's something very difficult to develop, and TM seemed to do it very well. And this is why the rational brain is on the left and the emotional brain is on the right. These are the lobes of the brain, the hemispheres, right, left hemisphere, right hemisphere. The left is rational, the right is emotional. So the way you develop emotional intelligence is different. EQ compared to IQ. IQ is rational. EQ is rational and emotional at the same time. So the only way you can do this is by connecting both of these hemispheres. The hemisphere of the right should speak a little bit to the left, and the opposite also, before you make the decision, so that you can actually, okay, briefly speaking, the rational side of the brain is usually narrow thinking. It's like, okay, 2 + 2 = 4, and it cannot be anything else. But in life, it's not so clear. You know, you have to sometimes nuance the thing. And these nuances are made by the emotional side. So in order to be a better man or woman, a better leader, a better work environment, you have to use both sides. So you have to have a technique that actually connects both sides of the brain, and it's actually what what TM does, basically. The capacity of TM to bring together the left and the right side of the brain is called brain integration, roughly. It integrates the thinking. Instead of being narrow, you start to see the bigger picture, and instead you make less mistake, you better judgment. You remember the student at the beginning? I told you it's because of brain integration. They became better student. If you're a lawyer or an accounting or whatever you are, you become better at whatever you do because you use more of your brain. So these are it's EEG, you know, this is the electric activity of the brain. You see, eye closed without practicing TM, there's not much communication. You see the up here, you start the front, the middle, the temporal level, and then the occipital are there anyway. It goes from the front to the back of the brain. These are electrodes that are on the head. And then when you practice TM, you see how nicely together the activity, the brain activity is totally harmonious. And it goes, it's called basically brain integration. Maybe in a month or two, I can give a more complete presentation about what it is, but it's very interesting to understand what is going on. So you actually connect both sides. So the physiologists, they knew about this. So they took the same people, the ordinary workers, 96 central office, the administrator and staff, San Francisco, the same thing I told you before, the same group of people, and did this brain integration scale. They were able to evaluate the integration of the right to the left and the left to the right. And during the study, practicing TM, it's only after 4 months, the group, the practicing TM, had a much better score at brain integration than the other one. And brain integration score is related to success in life. That's going to be another subject that maybe I can cover later, but the researchers, they found the best champion of the world in different sports, and also the best managers. You know, they went into company, and you see these kind of managers that they paid $2 million, $3 million a year for being the CEO of that company because they're so successful at getting. They pay these guys very lot of money because they're so good at achieving what they have to achieve. Yes, what they found? They found they're not practicing TM. They're just naturally like this. They have a very nice brain integration. EQ, okay? More EQ means you earn more money in a way, something like this. Much more success. Anyway, it's a big area of research. And actually, if you want to be the best in your class, whatever you are, probably you have to develop your EQ and your brain integration. That's going to be the recipe. And so far, TM seems to be good at producing that kind of individual. Here it's just you know, it's only a graphic saying that when you start practicing TM, very early, after only 2 months of practice, this measure here, the brain integration, kind of, it's equivalent. It's brain coherence, but that's the most important aspect of brain integration. Anyway, after 2 months, it's very high. You know, you close your eyes and immediately you have a very high degree of brain integration during the practice. But then when you open your eyes, you go back to your work, brain integration will go down like this. It's like the yellow one is during the task with the eyes open, you're working. Now here you practice TM, now you're working. But look, after 2 months, you're a bit higher than you were at the beginning. After 6 months, a bit higher, and 12 months, even higher. And then it goes up gradually. Brain integration is improve over time, because it's like practicing a sport, like you muscle, you practice, and then it stays with you after that. That's what it says. Gradually persist and integrates in activity outside of meditation. That's what the research says. And that's another study about the psychologists. They like this self-actualization. Self-actualization, it's a test that you can test people, and then you measure their integration and stability of personality, self-regard, emotional maturity, capacity of warm interpersonal relationship, and adaptive response to challenges. It is all these wonderful quality that everybody would like to have. But guess what? You don't learn this in a book or in school. It's the improvement of the connection of the brain that finally allows you to see the big picture instead of getting stuck into a small, picture. When you're stressed out, you're just stuck into narrow vision. And then you don't have this big vision, like innovative vision, creative vision, and everything. So usually self-actualization, it kind of develop all until about you're 20 years old, because the brain keeps developing. 24 years old, it's fixed. What you get, what you have is what you have for the rest of your life, self-actualization. But TM was shown to increase over and above what you have already. Look at these nice quality that everybody would have. So it's not only TM about burnout and stress. It's about making use of your full brain and developing full potential. This is very much about this. So that's the conclusion. TM, EQ, and brain integration will favor all psychological well-being, stress management. I hope you understood. You have the objective brain here. You have the subjective brain. They should be connected together. Then it's linked to organization effectiveness. Actually, as I told you, champions, usually the best leader, the best managers, they have usually more connection in the brain. And now we kind of found a way to take somebody and make more connection into anyone's brain. Self-actualization, these nice qualities. Voila. I think now, I think you understood. We should go to maybe questions. I'm ready. I hope you like it. Then tell me what you think.
Beautiful. Thank you so much, Dr.